Friends from the media, good afternoon. Welcome to the press conference of Anti-Epidemic Command and Coordination Group. Present today, we have Mr. John Lee, Chief Executive, Professor Lo Chong-Mao, Secretary for Health, Secretary for Transport and Logistics, Mr. Lam Sai-Hao, and also Deputy Secretary for Health, Mr. Vincent Fong. The CE will say a few opening remarks, and then there will be a presentation before we open the floor to members. CE. Welcome to the CGO to attend this press conference of Anti-Epidemic Command and Coordination Group. As the number of confirmed cases falls, after balancing a number of factors, we are going to enhance 4 measures to facilitate travelers to Hong Kong. First, for people arriving at the airport from overseas or Taiwan, the quarantine measures will be as follows. From the 3+4 quarantine arrangement, it will be changed to 0+3. The requirement for travelers to submit PCR test result will be scrapped. Instead, it will be replaced by an RAT result. And the restriction of uncompleted vaccination Hong Kong residents to Hong Kong will be removed. They can board a plane back to Hong Kong. And the return to Hong Kong and come to Hong Kong schemes will not have any quotas and will apply to all places from the mainland and from Macau. These measures will take effect from Monday, i.e. the 26th of September. First, the 0+3 quarantine arrangement. Under the 0+3 scheme, quarantine hotels will be scrapped. People who arrived at Hong Kong can return home or stay in a hotel of his choice to undergo 3 days of medical surveillance. During the period, they are allowed to go out, but they have to comply with PCR test requirements. Upon arrival, there will be a PCR test at the airport. There is no need to wait for the result before they can either return home or go to a hotel of their choice to wait for PCR result. So this is a test and go arrangement. The test and hold arrangement no longer applies. And they can choose any form of public transport. They can go home or go to a hotel for accommodation. And thirdly, after they've obtained a negative PCR test at home or in a hotel, they will be given an amber code for day 0 to day 2. During the period, they are free to go out, but during the 3-day amber code period, they are subject to amber code restrictions. They cannot go into scheduled premises where they are required to be checked, i.e. they cannot go into any catering premises. And on day 3, if they can get a negative PCR test for the previous day, they will be given a blue code so they can go into scheduled premises, including catering premises and bars. They're allowed to eat and drink there. The second measure is to remove the requirement for a PCR result, negative result, conducted 48 hours before boarding. Instead, they're required to present a 24-hour RAT negative result because travelers are not easy to get PCR tests overseas. The third measure is to allow Hong Kong residents who have not completed their vaccination program to board a plane back to Hong Kong. However, upon arrival in Hong Kong, they have to go through the current procedures before they can be given a vaccine pass. Fourthly, for come to Hong Kong and return to Hong Kong schemes, there will no longer be any quotas, and they apply to all places from the mainland and also Macau. They'll be given the same convenience to come to Hong Kong. Let me reiterate. This is the Hong Kong SL government's anti-epidemic policy. We're not going to lie flat. We have to control the number of confirmed cases. We have to ensure that our healthcare system can cope. We must reduce serious cases and fatalities. We must protect high-risk groups, including the elderly and children, and also the chronically ill. And we must use a scientific approach to identify risks, different risk groups, to allow the maximum amount of economic activities for the maximum number of people, but then we must balance the risk between risks and economic growth. We should give the greatest economic momentum to our society while we balance risks. Now, the decision is based on analysis of data, including the risk from overseas travelers to Hong Kong. The rate is not higher than that of the local community. We have to livelihood facilitation for arrival to Hong Kong, etc. We have balanced a number of factors before coming to this decision. Our direction is as such. While we can control the trend of the epidemic, we must allow the maximum room to allow connectivity with the world so that we can have economic momentum and to reduce inconvenience to arriving travelers. We will not roll back measures. In the past few months, we have adopted a number of measures, including abolishing the flight suspension mechanism. We have got the yellow and the amber and red code system to control risk, and we've also implemented a 0+7 quarantine scheme. Today, it is going to be changed to 0+3. We are moving towards the same direction, and all these measures must be rolled out in an orderly manner to ensure that each and every step is smooth without causing any chaos to our public transport arrangement and also manpower deployment. At all stages, these measures have to be implemented smoothly. Thirdly, we must maintain a positive outlook for the future. We adopt a positive approach for the trend of the epidemic. When you're willing to cooperate with our measures, including raising the vaccination rate for the elderly and the children, if you're willing to comply and cooperate with the government in our anti-epidemic measures, then with concerted efforts, then we should be optimistic about controlling the epidemic. As for data and data analysis of the 0+3 scheme, I will defer to Professor Lo Chong Mao or Dr. Lo Chong Mao, Secretary for Health, to explain, and then Mr. Lam Sai Hong, Secretary for Transport and Logistics, will comment on detailed traffic arrangements from the airport. And then Mr. Vincent Fung, Deputy Secretary for Health, will comment on the transitional arrangement for hotel accommodation. I defer to Professor Lo.
On behalf of the SAR, I'd like to explain our arrangements for travel and the details. The Hong Kong government is taking a scientific approach and is being accurate and precise in handling the COVID pandemic. Just now, the CE had emphasized that we have 5 strategic measures to deal with COVID, including, no, we're not lying flat. We're trying to reduce serious symptoms. We want to reduce death. We want to take care of the young and old. And we want to strengthen the people at risk, the control of people at risk. So we need to balance risks and economic activity. In this adjustment measure, we are focusing on this aspect. So let's review the Omicron situation. From the beginning of the year till March, the number of infected cases went up to 10,000 and had led to a lot of deaths. At the beginning of May, it came back down to a 3-digit figure, and there was an uptick. Now, even though the number of cases in July were stable, but by mid-August, it spiked again. And in recent days, it seems to have peaked, and there is a sign of it coming down. So looking at the date between July and September, we see that with the government and public's efforts, we had taken a lot of focused measures. The pandemic has impacted us significantly, but it's under control. The number of infected cases, the peak, we're not coming down from the peak. And if we review the last 2 months, in our local measures, we have a targeted approach, including wearing wristbands for home quarantine, lowering the vaccination age to 6 months. The number of PCR tests on average, the daily figure is 150,000. It's almost 3 times the peak, and we also require people who attend meetings to do RAT tests. Medical staff need to do tests, and we also have more patients being referred to private hospitals. We also adjusted the vaccination pass requirements. Now, while the number of infected figures have gone up, the SAR government has taken some measures regarding visitors to Hong Kong, including the temporary suspension of flight suspensions. We also had an e-reporting system to facilitate travelers arriving in Hong Kong. We also have the Amber Code that allowed us on 12th of August to implement the 3+4 quarantine measure. We also implemented a visitors policy where where travelers would only spend an hour or 2 at the airport and they could enter Hong Kong. We also adjusted our vaccination passport requirements. So all these measures reflect that the SAR government is taking a targeted approach, and the SAR government has been enhancing our immigration procedures, and we've allowed Hong Kong to integrate with the rest of the world more smoothly. An important note that we should bear in mind is that compared to the beginning of the year, there's been a big difference that the number of vaccinated people in our population. So we have to thank the different parties, including government, civil service, the HA, health department, the private medical institutions, and even the public have supported the vaccination program. So we observe that the number of people who had one vaccination, from 70%, it's now almost at 94%. So that proportion is very high compared to the rest of the world. And the number of people who have received 3 vaccinations, the third jab is a booster shot, at the beginning of the year was only 10%, and it rapidly went up to almost 77% now. So this is also a very high vaccination booster jab ratio. We also have to take note of our young and old. They are an at-risk group. This will have a big impact on our healthcare system. So children under the age of 11, their vaccination rate from February, when they started getting vaccinated, the ratio is now 72% who have received 1 jab. The third jab is at a lower level. It's roughly 16%. And for people above 80 years old, their vaccination ratio has also gone up significantly. The first jab being at 20%, and it's now standing at 71%. So the third jab, the booster shot, was less than 10%, and it's now close to 55%. So that is why we have been able to see significant improvement from the period of July to September. So we have to emphasize that these figures are not at the ideal stage. We want to better protect the young and old. So we need to enhance their vaccination rate, especially they need a third jab, a booster shot, before it can be deemed ideal. So for those below 11 years old and those above 80 years old, their vaccination rate has to pick up in the coming days. So we can compare our situation to Singapore, where they have 2/3 of our population. So in summer, they saw a peak because of BA.5. They had some 20,000 cases per, and on the Hong Kong side, we see that with serious cases or death cases, the vaccination has been effective. So we don't see a large increase in deaths or patients with serious symptoms. So BA.2 was a serious wave, and that is now standing at 80%. At this point, we have reached an effective infection rate of less than 1. That indicates that the number of infections will come down. Our community testing centers, where they are able to detect positive cases, we also see a downward trend. So all this reflects that the Omicron wave is coming under control. Actually, for us to return to normalcy, we need the medical system to return to normal first. If you look at the beginning of July, there were projections that these projections were based on the assumption that if BA.5 were to be a dominant strain, we would be facing severe challenges. The projections were in mid-July, we would face phase 2 of hospital authority deployment, phase 2 deployment, and in mid-August we would be in phase 3, and even at this point we might have to face the phase 4 of HA deployment measures. And in phase 4, that means we need to deploy 5,000 beds, and there might have to be one designated hospital designated as a COVID hospital. But through our efforts, our phase 2, on 22nd of July, we undertook the measures. The bed space usage was more than 1,500. But overall speaking, by September, we see that the pandemic has tapered off. And on 22nd of August, we undertook phase 3 measures. And looking at the current situation, we won't need to deploy phase 4 of COVID measures. And the hospital authority can return to phase 2 operations very soon. The number of quarantine beds and the number of admitted patients will reduce to below 2,500. And more importantly, we can resume 80% of non-emergency services. So that we won't affect our public services. So aside from controlling COVID and returning hospital authority to normal, and also adjusting our inbound travelers, we also note that starting from 22nd of August, when we implemented 3+4, the number of Hong Kong visitors has increased because we reduced the number of hotel quarantine days. So the number of tourists increased by 20%. At the same time, we see imported infection cases, the numbers have been falling. So the daily figure of 195 on average, and we're now standing at, even though we have more visitors, but the number of infected cases are now at 173. So ratio-wise, the number of imported cases per 1,000 inbound tourists, we have 33 positive cases. Compared to the past, it came down from 4.7% to 3.3%, and we can see the blue line here is the inbound tourists. The orange line is the number of positive cases, and we see that it has come down. So that reflects that the global figures are falling, so we see fewer infected cases. Another reason for us to consider adjusting our inbound tourist policy is that when we implemented 3+4, we also implemented a red amber system. So through the red amber codes, we can have measures to restrict high-risk people from entering high-risk venues, and that can help us control the infection rate.
Starting from the implementation of the coding system on the 12th of August, our law enforcement agencies have not found any amber code persons going into restricted premises. And for those red code cases, violation cases, we have not identified any relevant arriving passengers or travelers to Hong Kong, and that is we haven't had any red code to yellow amber code to yellow code persons, and so imported cases have not impacted on our local epidemic situation. It has not burdened our healthcare system, so we can adjust the measures. Why do we think that this 0+3 quarantine arrangement can control risks? For every 1,000 arriving travelers to Hong Kong, as I said, the rate of positive cases is about 3%, so we have potentially 30 cases through PCR tests at the airport, and also the amber code restriction during the medical surveillance period to prevent them from spreading the disease to the community. We've been able to identify 12 cases, and we can immediately use a red code to restrict the entry into the community or high-risk places. And then 4 more days of a PCR and RAT test, what we call self-monitoring period, while they are in a blue code. For PCR to be conducted on days 4 and 6, is quite likely that we can identify the remaining 6 cases. And then a red code can also prevent them from spreading the disease to the community. So I will explain to you this 0.3 arrangement. First, pre-boarding requirement. We have simplified pre-boarding requirements for Hong Kong residents. Even though they are not vaccinated, they're still allowed to board a plane. But because they have not been fully vaccinated, they cannot get a provisional vaccine pass. After they arrive in Hong Kong, they should get vaccinated as soon as possible. For non-Hong Kong residents, they must have completed vaccination or got a medical exemption from vaccination before they can board a plane to Hong Kong. Instead of asking a PCR positive result 24 hours before boarding or 48 hours before boarding, they can present a negative RAT test done 24 hours before boarding, and they can also make use of an online health declaration system to obtain a QR code. And then at the airport, we're going to implement a test and go arrangement. After a PCR test, they're allowed to leave the airport by means of public transport or transportation of their own arrangement. And then there will be 7 days of medical surveillance the so-called 0+3 period. They're allowed to stay home or in a hotel, but they are subject to the amber code restriction. And on day 4, if a previous PCR test is negative, then they can turn to a blue code. And then on alternate days, they are required to do a PCR test, and then they can also go out if the RAT test is negative. So the 7 days are: day 0, arrival in Hong Kong, 3 days of medical surveillance, and at 9 a.m. on day 3, a negative result will be given an amber code, and then a blue code at 9 a.m. until day 7. That is self-monitoring period. They have to conduct PCR tests on day 4 and 6, and also an RAT test on day 7. PCR tests can be done at community testing center, mobile testing stations, or recognized private laboratories. This is a comparison of the 3+4 and 0+3 schemes. First, pre-boarding requirements. Under 0+3, inbound travelers no longer to do a PCR 48 hours before boarding. Instead, they can do a 24-hour RAT test, and the result can be declared electronically. And then vaccination requirement. Hong Kong residents can board a plane to Hong Kong even not fully vaccinated, but they cannot be given a provisional vaccine pass in Hong Kong. And non-Hong Kong residents, instead of test and hold, it will be a test and go arrangement. And leaving the airport, instead of arranged transport, it can be arranged by travelers themselves. And then there is no need to go to designated places for PCR tests, and also the amber code will be until day 3, and then a self-monitoring for 4 days, and PCR tests on alternate days, RAT on a daily basis, an isolation arrangement for confirmed cases. These inbound travelers, now if their risks are as low as the local community or even lower, then the isolation arrangement will follow that of local cases. That is, they can be isolated at home, in a hotel, and if the home or hotels are not suitable for isolation, then they can go to community isolation facilities. So these new measures will start at 6 a.m. on the 26th of September, next Monday. That ends my presentation. Secretary for Transport and Logistics, Mr. Lam Sai-hong, will brief us on the traffic and transport arrangements. Thank you. In relation to the newly announced measures, we expect there will be more inbound and outbound travelers. So we will maintain close liaison with public transport operators. There will be higher frequencies to ensure that transport to and from the airport will support the operation of the airport. For Airbus companies will enhance the frequencies. So instead of just providing service at peak hours, the services will be extended to non-peak hours. And for overnight buses from airport to the urban areas and NT services will also be strengthened. Airport Express, MTL-CL enhanced frequency last month, running at a frequency of 15 minutes per train. And in light of the actual circumstances, services will also be stepped up. For taxis, we'll maintain close liaison with taxi associations to ensure that arriving travelers can get a taxi very easily. All in all, we will liaise closely with the airport authority and public transport operators so that we can be well prepared, and we will monitor the actual utilization of our airport to adjust public transport services to and from the airport. Thank you.
秘書長，
Mr. Fung will be talking about the hotel arrangements. Friends of the media. So we've had the CE and Secretary for Health give us some statistics and figures. I'll be talking about some arrangements. Now, it is similar to previous 3+4, and we will maintain these similar arrangements. That is, in the coming days for inbound tourists, if they take a designated bus coaches or designated taxis to designated hotels, will maintain the arrangement. Up until the 26th of September, we will have the new measures in place. In other words, on the morning of the 26th of September, all the tourists in designated hotels, they can leave in an orderly manner, and those hotels will become regular, normal hotels. So some individual travelers might want to continue to stay in the hotel, and they can make negotiations with the hotel. So the government's contractual arrangement with hotels, if there is any change in government policy and the travelers leave early, the hotels need to refund the tourists. And on the morning of the 26th of September, according to the Amber Code system, they can leave the hotels freely. And that's all I have to add. Okay, so we welcome any questions now. So please use your microphone, identify your media outlet, and we have quite a number of reporters. So please keep your questions brief, and we'll take the first question. Cable TV, I want to ask the 0+3 arrangement. Have we now chosen to coexist with the virus? Is that going against the central government's policy? Have you consulted the central government? And the CE said that you're not backtracking. So are you pledging that we won't go back to 3+4 and so on? Now, we've also heard that coexisting with the virus is a one-way ticket to hell. So when the tourists do a RAT test, do they keep the sample, the test kit, and do you think this scheme is attractive because they are still restricted from going to restaurants and hotels? I think you need to keep your questions brief. We have to allow sufficient time for your other reporters to ask questions. We cannot answer too many questions. So why don't you just choose 2 questions? I will deal with the first 2 questions. Now, I made it clear just now that the SAR government has 5 major policies regarding COVID. You see that we are controlling the number of infection cases. We want to bring the figures down such that Hong Kong can reduce the number of infected cases. So that has been our approach, and that is the same as the mainland. So we want to protect our medical care system. We want to ensure that high-risk patients can be taken care of. So we're taking a focused approach. And when you balance all the factors, we are able to control the pandemic, and we also allow sufficient economic activity. And we also maintain a connection with the outside world. So I think this has been our goal. Second, the SAR government has considered all factors in coming to a decision. And your second question, third, now I referred to I already stated my goals. We have 3 goals. The first, we want to control the infection rate and also provide an opportunity for economic activity and connection to the rest of the world. We want to maintain our competitiveness. And of course, uh, if there were new subvariants or if there were new developments, then uh, we don't have a crystal ball and we cannot guess what the future holds for us. But given the current conditions and trends and looking at our actual data in Hong Kong currently, if there is no significant change, then if barring any exceptional cases, we are confident that we can maintain our number of infection at a reasonable rate. Now, I said just now, our assessment of the infection figures would be larger than 11,000. Our control measures and our vaccination rate, plus our public support, they have complied with social distancing and other measures. That has allowed us to control the disease. We've been able to keep the situation under control, and we are therefore confident that if everybody works hard, if we can have a positive outcome. So given that, we don't want to backtrack. Next question.
Okay, so why isn't the government rolling out a 0+0 policy, given that Professor Low said inbound travelers haven't been putting pressure on the medical system in Hong Kong? And like, is this relaxation this time the only plan the government has right now? Or is this a part of a larger timetable to scrap more COVID measures? And the second question, how confident are you that the relaxation will be effective in encouraging more incoming business travel, given that the travelers still can't enter premises like restaurants for the first 3 days? And do you have any specific targets as to how much you want incoming travel to increase by? Thank you.
Well, first of all, I think in the 3 elements I mentioned as our road to the future, we emphasize, first of all, aim at one single direction as much as possible and do it orderly and progressively. And we should take a positive outlook of the situation. So we want to introduce measures that we are confident of maintaining the control of the overall epidemic situation. We also want to ensure that as we progress, we can do it in an orderly manner. By introducing this new measure of 0+3, obviously, this is a kind of relaxation from the 3+4. So we want to ensure that we will monitor the situation closely so that all the risks are well controlled and things can progress in an orderly manner. We will, of course, keep monitoring the situation. If there are positive developments as we progress, as I've explained, there will be more room for us to do extra measures so that we can have more movement, more activities, and more room for us to go about different maneuvers. So the intention is to do it progressively and orderly. That is why we are now introducing 0+3, which is actually quite a big improvement from the 3+4. The second question about the new measures how would it attract visitors to Hong Kong? I think it's not just the 0+3. When we talk about visitors coming to Hong Kong, of course they will consider the control measures. They will also consider what are the purposes of the visit, what are the advantages of the visit, and what do they want to do in Hong Kong for their benefits and interests. And I think Hong Kong has always has this attraction. We are the freest economy in Hong Kong. We are a place of opportunities. We are a place where the East meets West. We are the place where you will be able to have success stories. And we are also the place where there will be opportunities for us to open into the market in the mainland. So all these are factors which will be in the mind of any visitors when they think of coming to Hong Kong. Then, of course, I have said that 0+3 is the measure we introduce now. If there are positive developments, then, of course, we can have more room to go into further consideration as to how we will allow even more activities and create more convenience. I think it is important for people to know that we are aiming at one single direction of allowing people to come with more convenience, and they are allowed to go about their activities with the maximum possibilities. And you can also see after the third day, in fact, he can visit in the same way as the Hong Kong citizens, places where they can even eat and drink.
局長。
Secretary.
Data to supplement the reason why I don't agree with what you said, that there is no risk for the 0+0 if we adopt it now. We have data to show that the 3+4 will not increase the risk of community spread in Hong Kong. And we also just now provide information and data to tell you why we think that we estimate that the 0+3 will not increase the risk of infection in Hong Kong, because after 3 days of yellow code and the 2 PCR, the risk has become down to 0.6%, which is less than the local situation. But I'm sorry, we don't have any data to say that 0+0 will not lead to a community spread, higher risk, because we know that for those who are the inbound travelers positive rate is now still 3%, which is definitely higher than the local situation. And at the same time, there are new variants, new viral variants, which are coming up in different parts of the world. And we need close monitoring to make sure that these new variants will not come in. That is one of the reasons we are so conscientious about PCR tests for these inbound travelers, and to make sure that we will be doing sequencing for these new PCR positive cases to check whether there are new variants coming in.
下一位提問啦。
Next, the journalist in blue. I'm from News. I've got 2 questions. It's expected that with the relaxation, what do you think will be the trend of the epidemic? Will that affect our reopening of the borders with the mainland? And both the business sector and the travel industry would like you to implement the 0+0 arrangement. Do you have any plan to do that? Do you have any incentives to attract any measures to attract investors and visitors to Hong Kong to enhance our competitiveness? We've said a number of times the connectivity with the world, a normal cross-boundary travel with the mainland are not mutually exclusive, and we are striving to achieve both very proactively. Any measure to facilitate travel is important, not just to travelers, but to Hong Kong as well. So we are striving for connectivity with both the world and the mainland, and the two are not contradictory. As I said, we will try to suppress the number of cases as far as possible, and we will applaud if we can reduce the number to 0. We're now discussing this reverse quarantine arrangement with the mainland, and I've already announced that to you. And we are now discussing with mainland officials how this can proceed. Of course, the mainland has its own epidemic control measures and standards. Now, we would like to have reverse isolation or quarantine measure, and we need the approval of the mainland first. And this has nothing to do with the number of cases we have in Hong Kong. People who have gone through the reverse quarantine arrangement into the mainland have already removed all risks because they have gone through the 7+3 arrangement. The question is whether they go through that in Hong Kong or on the mainland. But we have to let mainland officials understand our arrangements, and we are trying hard to achieve this. So long as we have a common goal, I'm sure that while it may take time, to work out the actual arrangements, I'm sure we have the chance of achieving that goal. The business and tourism industries would like to shorten the quarantine arrangement to 0+0. Do you have any timetable to achieve that? And will you have any measures to attract investors and visitors to enhance Hong Kong's competitiveness? Our target is to introduce the least amount of measures to give the greatest convenience. To achieve greatest convenience and minimal controls, of course, we have to keep an eye on the trend of the epidemic. But in terms of vaccination rates and cooperation with the government's control measures, our experience in this wave is the number of confirmed cases can be lowered to a large extent than what we envisaged in the first place. So I'm optimistic about controlling the epidemic situation, yet there are always uncertainties in controlling the epidemic. So when it comes to the trend of the epidemic, we would like to provide the greatest room to allow the greatest amount of activities in the community. That is our direction. The gentleman in the far right back, I'm from RTHK. Talking about this 0.3 arrangement, yes, it can facilitate people to go out, but then home quarantine is required. We may not be able to attract overseas visitors. Places like Singapore and Japan have already scrapped all quarantine requirements. So 0+3, will that be too little, too low, too slow? And under what circumstances and what conditions can we achieve 0+3? Will we have to observe for a month until end of October, until the 10th plenary session is over? That's about it. As I have explained, before launching any measures, we want to do it in an orderly manner and on the basis that risks are controllable. Every time when we roll out new measures, we follow this approach. So if these measures are successful, then we can proceed faster. In any event, we will have to roll out anti-epidemic measures based on our actual circumstances. I outlined 5 principles, not just one. We have to ensure that our healthcare system can cope, and the number of confirmed cases must be contained at a manageable level. We must protect the old and the young, and we must balance risks, and we must have risk management. There are 5 major principles. I reiterated them to you because if we only consider one principle, then they should bear in mind that we have to consider the 4 remaining principles and balance all these. Of course, I hope that every time we have a new arrangement, it can be smooth so that the next round of arrangements can be further improved. Then based on the risk situation, if the measures are smooth now, then we will have the maximum room to allow maximum level of activities.
今日
So let's take the last 2 questions. An English question.
左手邊白色衫嘅記者。
Hi, question from CNA. Hong Kong has been known for its most stringent COVID policy in the world for over 2 years, and this shakes the confidence of those you want to attract. So what safeguards do you have to ensure that this latest policy will not be reversed, given that COVID constantly evolves? And second question is, what does the scrapping of hotel quarantine mean for alignment with China's own policies? Do we foresee any delay in talks of reopening with mainland? Thank you.
Well, first of all, I have explained many times that the 5 principles that Hong Kong government adopt in designing the anti-COVID measures. In other words, all the measures that we consider and roll out take into consideration of the prevailing local situation. We have to ensure that, first of all, our hospital service can cope. We have to protect the very young and the very old who are high-risk groups. We have to ensure that we reduce the number of serious cases and death cases. And we want to do it scientifically so that we will control the epidemic through different risk levels by differentiating them into different levels. And then, of course, we want to balance the need for controlling the epidemic with society need, economic need, and also to raise our Hong Kong's competitiveness. The road to the future has been explained by me at this conference. I aim to take one single direction so that we can maximize our activities, maximize our connectivity with the world, so that we will be attractive to visitors. And I want to roll out our measures in an orderly and progressive manner so that there will not be chaos and people's experience will be under our expectation. And also, I take a positive outlook of our future because this wave of epidemic has given me the confidence that our measures can tackle the rising speed of the cases, because the number of cases actually are lower than what we initially expected. So I want to explain to you these 3 elements so that people know that This is the strategy. This is the road into the future of the Hong Kong government. Single direction, progressive and orderly, and then also we take a positive outlook into the future. And I'm positive in my outlook of the future because we have proven that we can tackle the situation in the present wave. Our attractiveness, of course, is partly related to anti-epidemic measure, but we have a lot of appeals, a lot of strong points, a lot of advantages. When people consider whether they come to Hong Kong, of course, besides the epidemic measures, they also consider what benefits and what interests and what gains and how coming into Hong Kong will help their overall development. We are the freest economies in the world. We have a very well-developed infrastructure. Our tax rate is very low. Our taxation system is simple. And opportunities are abundant in Hong Kong. Also, Hong Kong is the gateway into the mainland market. So we have a lot of appeals and attractions, a lot of advantages that people will take into consideration whether they come to Hong Kong. And I want to reduce the inconvenience as much as possible. So we will do it progressively and orderly. And I'm sure that what we'll do will, in reducing inconvenience and letting people know that we are doing all these in order to maximize the possibility for maximum movements and going about people's activities in the way they wish, including that after the first 3 days, they already can go to places in the same way as a normal Hong Kong citizens, where they can eat and drink. Then they will find that Hong Kong is creating opportunities and a lot of convenience to them in the context of the epidemic situation. Having said that, if we are successful and things go well, then of course we'll be considering other new measures to allow even more activities in Hong Kong, and also allowing more convenience for travelers to come to Hong Kong. So I'm optimistic that the measures that we roll out on this occasion will be welcomed by people who want to come to Hong Kong.
得咪今日最後一題嘅問題嘅，右手邊嘅。
Let's take the last question. TVB, the government has said that you will be taking an orderly scientific approach, but why is it 3 days? Why can't it be less? A lot of people have said that it could be 0 + 7. Why have you finalized 0 + 3? And why do we still have the amber system? When you attract tourists to come to Hong Kong, how helpful is it? And our local measures, if we can relax inbound tourists, can we relax inbound tourists from the mainland? Well, I have already answered your question. Let me repeat. We've considered while we can manage the risks, we want to create the maximum economic activity and reduce the inconvenience of quarantine measures. So we've balanced all the factors, and we want to create the maximum freedom for tourists to come to Hong Kong. They can find it convenient and attractive. So that's why we have the 0 + 3 scheme. I've also mentioned after implementing 0 + 3, we will monitor the situation. If the situation warrants it, and if the infection figures are within our control, then there is room for more maneuvering. We can roll out more measures and reduce the inconvenience. We can, so that has been my explanation on numerous occasions. Okay, that concludes the press briefing. I'll take that question. It's actually very simple. First of all, we encourage all people to get vaccinated because that is positive. It's helpful for our healthcare system, and of course, we have a responsibility to take care of Hong Kong people. So we encourage everybody to get vaccinated. That's a recommendation by WHO as well. And if a person does not get vaccinated, we have to think of Hong Kong's situation when making these considerations.